what kind of insurance we have provided the mandates. That's being set up this morning in Washington, D.C. We have to put the brakes on that.
Just a round of applause. Thank you.
Unemployment is 2% in D.C. Next, B.J. Lawson.
Thank you very much for coming out here. I really appreciate both Dr. Brannon and the work that Founders Truth has been doing. And I can't thank you enough for making the trip all the way out here from Texas. Now Dr. Burgess come out in support of our campaign. And my dad actually made the trip out. He's from Texas as well. There were a lot easier ways that Dad could have seen his congressman, but I really appreciate both my dad and Dr. Burgess being here. I think in the description of the problems that we face through this legislative process, it really highlights the fundamental reason why I'm running for Congress, and that's simply that our process of government in Washington is simply broken. It doesn't work anymore. And when I began to look at how our government works together with our economic system about 10 years ago now, when I was starting this hospital software company out of residency, it began to become clear to me that while we had some idealized notion of what our federal government does and how it operates based upon high school civics class, the reality is completely unlike anything I'd ever seen in my life. And one of the reasons I found it particularly appalling, having gone through medical training, is that when I graduated from medical school at Duke, you go into Duke Chapel, you take the Hippocratic Oath. And part and parcel within the Hippocratic Oath is this idea that above all else, do no harm. If you're going to do anything, just be sure you don't hurt the person. And when you look at the way Washington's operating today, it's very difficult for me to think that that one fundamental aspect of what I believe to be important, both as just a person and as a Christian, but as a physician, don't hurt other people. But yet that is what our government is doing. And it's getting to the point where the process is out of control and the government is being run by a coterie of Washington insiders and lobbyists and special interests who have access to the levers of power and who are consolidating power in Washington to take more and more control out of the hands of us, the American people. And that means us as individual businessmen and entrepreneurs, us as patients, us as physicians. We are the ones who ultimately are giving up this control and have given up this control through a government that just doesn't know when to stop. I have another good friend, Tom McClintock, who was elected in 2008 in California's 4th District. And Congressman McClintock's chief of staff is a gentleman named Igor Bierman, who is extremely educated and articulate. He's a first-generation American immigrant from Russia. And he knows not only the law, but he knows his history. And he talks in great detail about how what we are doing to ourselves through an expanding bureaucracy out of Washington that grows without boundaries is exactly what brought down and brought the economic collapse upon the Soviet Union. When you get to the point where bureaucracy become a self-fulfilling prophecy, it exists to grow itself. And you get to the point where doctors aren't free to take care of patients, farmers aren't free to grow food. What are we giving up when we go down this road? So, with respect to our congressional campaign, I'm just a regular guy asking basic questions. David Price has spent at this point about $200,000 on a bunch of television ads accusing me of being somewhat extreme. But when you look at his voting record and the fact that he votes with Nancy Pelosi more than any other congressman and has presided over an increase in our national debt from just over $2 trillion when he came to Congress in 1987 to over $13 trillion. That's $11 trillion over 11 terms. Those are the things that I find extreme. And more than extreme, they're extremely dangerous. Because at the end of the day, I'm an engineer, I'm a geek, I get into the numbers. And when you look at the numbers and the way we're going, it's just, the math doesn't work. So I have a lot of concerns about healthcare, about the economy, and about how we get our jobs and our economy growing again. But at a very basic level, the only question that I'm asking is if we want to make a better world for ourselves and our children, so that our children and our communities have better opportunities in the future, should we be giving more power and influence to Washington? Should we be delegating more control to Washington? Or should we seek to restrain the government in Washington and have it focus on what it should be doing while we start to take on more responsibilities ourselves right here in our backyard? I do not believe that prosperity can come from Washington. I do not believe that great, compassionate medical care can come from Washington. It has to come from right here in North Carolina's 4th District. That's the message of our campaign. And there are people who, despite what I believe to be solid historical evidence to the contrary, who believe that we can build a prosperous future through central planning driven by Washington and bureaucratic elites. I believe that history speaks otherwise, and I believe that this November 2nd, we're going to see the results of an election where the American people, the people of the 4th District, believe otherwise. Because talking about a government that lives within its means and its constitutional mandate, that's not just a line, that's not just a marketing slogan. Those are principles that make our country truly exceptional. And to the extent that we live up to those ideals, and we recognize that our federal government exists to protect the ultimate minority, the American individual, and to defend the right to life, liberty, and the pursuit of happiness, that's what's going to get us moving in a better direction. Now, specifically with respect to healthcare, I spent about 10 years outside of practicing medicine, but both on the IT and the administrative side. I became convicted a couple of years ago when I was just looking at the numbers when I was running for Congress back in 2007 and 2008, that the only way we can fix healthcare is we have to start by fixing primary care. Because what's bankrupting us is our inability to provide, to effectively manage chronic disease. And it's the chronic disease that leads to the poor quality of life and the expensive hospitalizations and the surgeries dealing with things like heart disease and cancer. And I'm going to pick on my dad for a minute here because my dad is probably the best example of what our healthcare system needs, which really has very little to do with doctors. Do you mind if I tell the story, Dad? So I got a phone call from my dad when I was I was still employed by the company that purchased our company. How many years ago was that when you called me? I was in Colorado. About 5 years ago, my dad called me, and he was really passionately upset. Said, BJ, I just got back from my doctor. My doctor said I'm pre-diabetic. And my dad has always been a pretty healthy guy. But, you know, at the time, he was just about 6 feet tall, and he'd just gotten over 200 pounds. And so it was not a happy sight. And I said, Dad, the good news is you're not diabetic, you're just pre-diabetic. Here's what I want you to do. Don't eat anything white. And try to get some exercise. Because he'd been a runner. And he was acting up on him, so he stopped running. Long story short, he actually took my advice. I'm not a doctor, I just play one on TV. So he eliminated refined carbohydrates from his diet, got an elliptical trainer, and now, honestly, I'd say after this run, he's in better shape than I am. His blood chemistry is normalized, and he's not going down the downward spiral. But it takes that level of behavioral change to head off chronic disease. And when in primary care, right now, I've got a good friend of mine who actually did not sign up to work with one of our large academic medical centers going into primary care because they wanted him to sign a contract that said he was going to see a patient every 7.5 minutes, or else he was going to forfeit his productivity bonus. That's not practicing medicine, because when you only have 7.5 minutes with a patient, all you can do is say, what's your symptom? I got a drug for that, move on. There's no lifestyle modification, there's no sitting down with the patient and setting up goals and being the coach that patients need to avoid the scourge of chronic illness. But at the same time, primary care is not expensive to provide. It's not like you require a tremendous amount of overhead and capital investment in equipment, but yet we pay for it through a system of third-party reimbursement and insurance that adds typically 40% overhead, 40 to 50% overhead into every doctor's office. So when you hear people talking about on the left, oh, we need Medicare for all because that's so efficient, and Medicare only has 2 to 3% overhead, what they are conveniently ignoring is that just having to accept Medicare and file claims for reimbursement by Medicare puts that 40% overhead into every single doctor's office. And couple that with the realization that many doctors are having that the one way that this administration has found to decrease costs through healthcare reform, well, they're going to be going after fraud and abuse. Well, what does fraud and abuse look like? It's called recovery audits or RAC audits, where you have private contractors who operate on commission who then show up at your office and flash a badge and tell you, I want to see your charts, I want to interview your staff. They then go through your chart with a fine-tooth comb and look for places in your documentation where you didn't dot an I or cross a T. And that is a fine, it's a penalty, but it's also criminal liability because you are defrauding Medicare. It's not just civil liability, it's criminal liability. And I have met one physician in particular here in North Carolina who is one of 2 physicians serving in the poorest county in the state of North Carolina. This is a lady who tried to do everything right. And she, 5 years ago in her practice, invested in an electronic medical record to help her be more efficient in providing care for her patients, all of whom are either on Medicaid or Medicare. And when she did that, her billings went up because she was much better at capturing charges using the electronic medical record than she was just doing things on paper. 6 months after she installed this medical record, she gets a knock at the door from the folks doing the recovery audit. What's going on? You're billing us more money. She ends up with a penalty that was calculated to be over $50,000. Which, despite her not having, this is basically the entire system operating as designed, criminalizing someone who's giving good patient care. These are the kind of doctors that are being driven out of practice by a system of medicine that works great unless you're a patient or doctor. So what I tell people is, yes, we need healthcare reform, but it's about putting the doctors and the patients back in control and asking questions about how can we get the medical system to once again reflect the Hippocratic ideals that I believe are so critical in providing patient care. I'll stop there. We can order our food and continue the conversation. I appreciate everything you've done.